Hey guys, it's Devin Harrington, the average Gen Xer. Welcome back to my channel. On this channel, I talk about things that interest me, and that means that every once in a blue moon, I like to put out some content on something that's either a practice or a product or a book or something that I have found to be helpful, healing, useful in my life, and maybe it could help someone else. And for lack of a better title, I call that playlist Life Hacks. So today I wanted to talk about something that is kind of a cause that's near and dear to my heart. I have a medical saga of my own that goes along with this topic, and it is chronic pelvic pain. And I'm going to share a breathing practice in a little while that really changed my life. I mean, that sounds trite, but it's the truth. So let's get into it. Okay, so it should be said that I am not a medical professional of any kind. I am simply speaking on this topic as someone who has been the patient of many, many, many medical professionals to treat chronic pelvic pain over about a 35-year period. So I have a few things to say about it. I did find this article in Medscape. It's by Dr. Manish Singh from March 17th, 2023. And he says chronic pelvic pain is a common problem and presents a major challenge to healthcare providers because of its unclear etiology, complex natural history, and poor response to therapy. And when they say chronic pelvic pain, that could be anything between your ribs and, your middle thighs. But pelvic pain tends to involve the muscles of the pelvic floor. And it doesn't matter what gender you are, if you have a human body, you have a pelvic floor. And I'm not going to get into a big discussion of the names of the muscles or any of that. Just Google it. I mean, we live in that age now. Dr. Singh goes on. Chronic pelvic pain is poorly understood and consequently poorly managed. Yeah, you're fucking telling me. This condition is best managed using a multidisciplinary approach. Management requires good integration and knowledge of all pelvic organ systems and other systems, including musculoskeletal, neurologic, and psychiatric systems. And if you are a woman who has suffered with undetermined cause pelvic pain, painful sex, etc., you may have been told that it's all in your head. I know that's not what they're referring to by saying psychiatric systems, but the Western medicine has a long history of telling women that the pain is all in their mind. Anyway, he goes on. A significant number of these patients may have various associated problems, including bladder or bowel dysfunction, sexual dysfunction, and other systemic or constitutional symptoms. Other associated problems such as depression from chronic pain, yeah, anxiety, yeah, and drug addiction, ding, 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 may also coexist. In the United States, estimated direct medical costs for outpatient visits for chronic pelvic pain in women aged 18 to 50, and I mean, 50 is like not even that old. They should have studied, much older women as well. But anyway, from 18 to 50 is approximately $881 million per year in the US. So this is really the hard part of this video, because now I wanted to very succinctly and briefly tell my personal story. And number one, it's still to this day pretty embarrassing for me to talk about it. And it's on YouTube. But I'm sure I'm not the only woman who has suffered with chronic pelvic pain. And so my story is this: when I was 11, I fell. I was pushed by a boy I had a crush on, and like landed right on my tailbone on a rock. Any kind of injury in that area can cause all kinds of damage to the muscles of the pelvic floor. So then was riding horses for, I was working at a barn. I was riding horses a lot as I was growing up, et cetera, et cetera. Fell off a couple of horses, so I had some injuries going on. And when I was about 16 ish, 17 ish, um, I started feeling like I had a bladder infection or a UTI all the time, and I would go to the doctors, and my urine would not have bacteria in it. They would give me antibiotics anyway. This is like the late 80s. So I took round after round after round of antibiotics that basically destroyed the flora and in my intestines, and added to my problems. So now I had like horrible painful digestion, and imbalance of bacteria there causes yeast to grow. It was just a freaking nightmare. And back then, there's no internet. And as a teenage girl, I was way too shy and way too embarrassed to ever say anything. So time goes on and time goes on and time goes on. And just being, when I say pelvic pain, for me, it was basically burning urinary tract, like various levels of burning pain in that spot. And it also would mimic the symptoms of a bladder infection sometimes, and with urinary frequency and urgency. Sex was a horrible nightmare, and I'm not going to get into that right now, but just imagine growing up and trying to navigate the sexual landscape of the late 80s and early 90s, trying to be the cool girl. And I just never said anything to anyone. I was too ashamed of the whole situation because I felt like I must be the only woman on earth or young girl on earth that had this kind of pain. And so anyway, um, decades, years go on. I see urologist after urologist after urogynecologist. I was diagnosed by someone when I was 25. They finally just said, "You have interstitial cystitis." And that is a bladder disease that was discovered in the 1800s, and it's a horrific, basically an autoimmune condition where your body like destroys the lining of your bladder. It's horrible. And you get ulcers on the lining of your bladder. I mean, it's just like out of a horror movie. But it has become very, very, very common. It wasn't as common when I was a teenager, but that label of you have some kind of bladder issue, pain, chronic pain, but we don't know what it is and we don't know what causes it. And so we're going to say it's interstitial cystitis. And true interstitial cystitis uh, is very, very rare. Anyway, I didn't know any of that. I grew up and spent my 20s and my 30s and well into my 40s carrying around this shame of having this horrible incurable disease. I had doctors tell me, "Oh, well, you'll never be cured. You know that, right? There's no cure for it." Um, I had bladder installations that made it worse. It's just like the list of treatments that I tried from one doctor to the next, it was endless. And on top of that, I was doing massage therapy. I was getting massage. I off and on had a mental health therapist. I was doing my part, but I went through life with this burning pain that sometimes would flare up to really, really bad, where I just didn't want to be part of the human race because I didn't feel like I was part of the human race. And that is the psychological aspect of chronic pain, and chronic pain in the last place you want to have chronic pain. So um, this went on and on and on. And finally, in 2014, the Affordable Care Act went into effect. I was self employed at the time. I finally could get health insurance, and I saw one of the top urologists in Austin, Texas, where I live. And she threw everything she had at me, as far as, now it's decades later. And she said, oh, yes, the number of cases of interstitial cystitis has just basically exploded. And so she gave me different types of drugs, and there's one drug for that disease, and it's called Elmaron, and I took that twice for a year. Both times really didn't do anything. Imipramine and all these old antidepressants that are good for bladder stuff, and stuff would, like, I would feel better for a little while, but it would always circle back. It was just like being yanked around on a leash, by this chronic pain. And anybody with any kind of chronic pain will tell you, like, you're its bitch. It feels that way anyway. So years go by, I keep seeing this urologist, and nothing is working. Nothing is, like, getting down to the cause of my pain. And finally, in 2019, when I'm 48 years old, she finally says, well, I've tried everything, but the last resort I have for you is to go to pelvic floor physical therapy. And so she wrote me a prescription for that, which you need in Texas. And I finally had insurance. The copay was affordable, and I was able to go to a pelvic floor physical therapist twice a week for 6 months. And they determined that the entire cause of all my suffering was about 1 square inch of my compressor urethra muscle on the right hand side. There was a knot in it. It was in spasm. It had always been like that. Basically, I had grown up with it like that, so it stayed that way. And that muscle presses on the female urethra. And that was the cause of my problems. But the point is that wherever I had a sore spot in there, and that's the thing, is they put a finger inside you to work on the pelvic floor. And, that's why people don't want to talk about it. But we're going to talk about it here. So when I think that it was just after all of these procedures and all of these, I mean, they do a thing called a cystoscopy, where they put a camera in there and they look at the inside of your bladder to see if you have those ulcers. And I've had 3 cystoscopies over the years, and I never had them. I never had the ulcers. I never had those sure signs of interstitial cystitis. So it turned out to be a tight muscle. And being that I am, in fact, the average woman, I kind of shudder to think how many other women out there have some sort of pain that, it's not so bad that you can't work or do your life, but it's just there and making you miserable, and you just got to grin and bear it. And sex is, kind of sucks, but you just grin and bear it. That kind of chronic pain, upon decades, will twist your mind. And I just wonder how many other women are out there that have, you know, that have this kind of pain, wherever it is, whatever um, way it presents in them, or and how many of those women have been given that bullshit interstitial cystitis label when it could just be various muscles of the pelvic floor need attention, particularly for women who have given birth. And I don't have any kids, I just had a bunch of trauma and injuries when I was a kid. And it's just astounding to me that why didn't they send me as a teenager to pelvic floor physical therapy to begin with? Because it existed back then. But, we all know Western medicine exists to support big pharma and to give out prescriptions. And so they do the pharmacology first, when in reality, one trained human finger and time, because they just press around in there. And if you are biologically female, it's vaginal, and if you are biologically male, it's anal. But they're, pressing on different muscles, and when they find a trigger point, they just sit there. It's called soft tissue melting. I do it in massage therapy as well. And you breathe. And the therapist that really saved my life is a woman named Swapnali Chaudhry. I hope I'm saying your name right, Swaps. She is here in Austin. She runs Quintessence Physical Therapy. And I was lucky enough to get assigned to her when she was working at Austin Physical Therapists or some other place. She didn't have her own place at the time. And so I worked with different therapists, PT therapists, when I was going twice a week. And I happened to get Swaps one day. And I was in a lot of pain that day. And I mean, my pain, burning urethra. And it just, when you have pain, you want to clench around that painful spot. And I didn't know this at the time, but my whole life I had been essentially, if you think of your tailbone, I had been tucking my tail. And that is also something you can read about in this fabulous book that is kind of the Bible of pelvic pain. It's called A Headache in the Pelvis. It's been around for a long time. Highly recommend it. But the author talks about, we all walk around tucking our tail. And that does make sense to me, because we all tend to hike our shoulders up and scrunch our neck as a biological response to protect our head, being a massage therapist, it was always neck and shoulders, because people hold their shoulders up without even being aware that they're doing it. And the same goes for the other end. We're tucking our tail, like clenching your butt cheeks. For real. This is so weird to talk about this, but Swaps came in the room and she said, okay, let's go over 4-7-8 breathing. That's what we're going to do to start with. And I had never heard of it. And so she briefly taught me how to do it. And it's super simple. The best way to do it is laying down, particularly, like when you first get into bed. I do it every night. I just do it automatically. When you're laying down, and you can have your legs butterflied, or you can have your feet on the floor, knees bent, or, whatever is comfortable. And so you breathe in through your nose for a count of 4. So but you are aiming for your air to flow all the way down into your lungs. A lot of us just breathe thoracically, just in the chest. So it takes practice. It takes, consistency. But you will feel eventually that you can breathe and your diaphragm relaxes down and your pelvic floor muscles start to relax down. And it's very subtle and it takes a while to get that, but you breathe in for a count of 4, and that's what you're visualizing or thinking about, is all of this musculature all the way down past your perineum is going to relax down and out. You don't push or anything. It's just almost like a psychological thing. So then you hold your breath for a count of 7, or however long you can. And that's kind of when the magic happens, because you're holding your breath and you picture your abdominal muscles letting go. That was something that was, really took me a while to be able to do it correctly, because I've spent my life walking around holding my gut in to make myself look skinnier. So to breathe down into your belly and get your belly to let go and expand can take some time. And then further down, you'll feel, essentially your vaginal muscles if you're a female, and but it's essentially your pelvic floor, and then your vaginal muscles just relax down and out. And you're, again, not pushing. It's very subtle, but you hold for 7, and you think about everything just relaxing down and out. And then you exhale for a count of 8 through your mouth, as if it's just air leaking out of a balloon. So it looks like this. And that's 4-7-8 breathing. So I started doing that in that PT room. And within a few minutes, I said out loud, like, I already feel better. My pain is like backing off. And it had been flaring up that day. And so I still continued to see swaps, and eventually that tight muscle relaxed, and I continued doing the breathing, and the two go hand in hand. And it took me all those years and decades to find the reason, but I'm glad I didn't give up. So I found a article in Good Housekeeping about 4-7-8 breathing, and let's check it out briefly. So, this article is from Good Housekeeping, and I'm not going to read the whole thing, but everything will be linked in the description box. And it says, what are the benefits of 4-7-8 breathing? Obviously, you don't have to have pelvic pain to do this breathing technique. It's good for any human being. Research has shown that this technique can slow your heart rate, lower your blood pressure. It tells your body it's time to relax, says Johanna, who is one of the experts they talked to. In a matter of minutes, it will help you settle into a meditative, rested state. Also, by activating your body's parasympathetic response, 4-7-8 breathing has added benefits like boosting your immune system and helping your digestion. Another great result that this breathing technique can produce: a better night's rest. Sometimes it's hard to quiet your thoughts so you can fall asleep. By practicing 4-7-8 at bedtime, you can enhance your theta and delta brainwaves, which makes it easier to fall into deep restorative sleep. That's another reason why it's great to do. Just get in bed, do a couple rounds of it, and you will sleep better. If you wake up in the middle of the night, 4-7-8 can help you fall right back to sleep too. The breathing should be perfectly safe for most people, although you should check with your doctor before trying it if you have a history of any respiratory illness or disease. So I will link that article below, as well as anything else that I mentioned in this video. I would like to say I spent many, many years without health insurance, and could not afford to do pelvic floor PT. I actually did try it years before I actually was able to stick with it, and it was too expensive. So I only went once or twice. But if you can't afford to go to PT, if it's just not in the budget right now, we are fortunate these days to have resources that I couldn't have dreamed of when I was a kid. You can get a pelvic wand that you can use to work on yourself. That and the 478 breathing, if that's all you did, um, that would be helpful. And so this video is just to share my story and to give anyone who is suffering with pelvic pain, because it is a horrible place to have chronic pain, some hope. So if you made it to the end of this video, you know you're a trooper. Thank you so much for watching. If you like this video, please like it. Every time I make a life hack video, about 187 people worldwide watch it. So if you're here, I really appreciate you being here. Thank you so much, and I will see you guys in the next video.